Coming to the clinical features of chickenpox. It is divided into 3 stages. First stage is prodromal phase or pre-eruptive phase. Second is eruptive phase, and third is recovery phase. Prodromal phase starts as fever, upper respiratory symptoms, for example running nose, malaise, anorexia, headache, conjunctival congestion, etc. can be seen in prodromal phase, and it lasts for 1 to 2 days. After the pre-eruptive phase, eruptive phase begins. That is, rash appears in eruptive phase. Intense pruritic macules develop with area of inflammation around. These lesions evolve from macules into papules into vesicles, and later this scab forms. The rash is described as dewdrop rash. That means clear fluid-filled vesicles on the skin with area of inflammation around them resembles like a dewdrop on a rose petal. You can see the vesicular rash in chickenpox in the left side, and in the right side you can see a dewdrop on a rose petal. The rash in chickenpox is superficial, unilocular, symmetrical, and in centripetal distribution. That means the rash first appears on the trunk and then spreads to face and limb. It involves flexor surfaces. It also involves axilla, scalp, oropharynx, but it spares palms and soles. It is a pleomorphic rash. That means the rash occurs in several crops. Approximately total 5 crops can occur. So the lesions can be seen at varying stages of evolution at the same point of time. That means fresh crops may be seen as macules and papules, as well as at the same time old crops of lesions may be seen as vesicles and crus. You can see the vesicular rash on the right upper side, and in the left lower side you can see the crusted lesions. So it is defined as pleomorphic rash. That means varying stages of lesions can be seen at the same point of time, and the symptoms persist for 2 to 4 days after onset of rash. Rash lasts for 3 to 5 days. New crops of lesions are rare after 5 to 7 days. After the disappearance of rash, hypo or hyperpigmented macules can be seen for days to weeks. Residual scarring is not seen unless the lesions are secondarily infected with bacteria.